Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in. Today, we continue to open them up to you today. We enjoyed spending some time with you on Friday. We'll enjoy allowing you to come on in today and set the agenda if you'd like. Anything on your mind is okay with me. I've got a number of things, as I always do, on my plate to share with you. What would you like to share with us all? The number to do that sharing, of course, as you well know, 412-825-6262. That's 412-825-6262. Open phones today, and hopefully you'll take me up on my offer. Just be listening for that knock on the door. Now, as the calendar is shaping up, we're looking, and this is the last week in March, folks. We are turning that page, and it's coming up, literally the last day of the month is on Thursday. As I look into April, it is jam-packed in April. We're going to have a number of visits, certainly two I've got scheduled so far, with Dr. Edward Kondrot. Now, you know Dr. Ed. Dr. Ed is a Pittsburgher, practiced pretty active practice in the Mount Lebanon area for a number of years. But then, a number of years ago, packed the whole dog and pony show, took it out to Phoenix, and there he was for a number of years, hadn't heard from him at all. And then all of a sudden, he's back. He's not just back here in Pittsburgh, he's traveling all over the country. He has such a unique treatment program for eye disorders that he offers it in various pockets of the country by coming to you. Now, he's been in Pittsburgh many times, offering those seminars, those treatment seminars, and he will be back again this spring. He's scheduled to be here in Pittsburgh to do, there's two kinds of seminars. One, a general seminar where everybody's invited to it to be able to ask whatever questions and get any questions answered with respect to his treatment program. That's going to be held on May 8th. It's going to be between the hours of 1 and 3 o'clock. And then 9th, 10th, and 11th is going to be the time when his actual treatment seminar, for those who have taken him up on his offer and would like to be treated in a new and distinct way. He is an ophthalmologist, yes. He's a medical doctor, yes. But he is absolutely different from any of the other ophthalmologists you've ever been to in that he treats, alternatively, uses microcurrent stimulation a lot, and a whole host of other things. Anyway, all of those conferences, the general conference on the 8th, as well as the treatment conferences on the 9th, 10th, and 11th, going to be a change this time. It's usually held this at a hotel nearby, but this time it's going to be held right in my office. We're going to be opening up the entire office to just Dr. Kondrot and all of his patients, which he says he likes to get about 10 per session. According to him, he already had 5 or 6. There are a few more slots left. If you're thinking about it, you'll definitely want to stay tuned to our discussion with Dr. Kondrot. He's going to be our guest on Friday, April 1st. He's going to come back on Friday, April 8th. You should be able to get enough information out of those 2 visits here on the radio show to at least make you at least inquisitive, and then take him up on his offer, being able to listen to his general seminar absolutely free on the 8th, right here in my office from 1 to 3. So that's Dr. Edward Kondrot. A lot of activities, a lot of festivities, taking place in April and in May around his visit to Pittsburgh. On the 6th of April, Susan Smith-Jones comes back. Now, she was here just last month. She literally keeps on coming back just about every month. She really enjoys being with the Pittsburgh audience, even though she's got to get up at ungodly hours out there on the West Coast. She was here last month talking about weight loss tips. She's going to be here on the 6th talking about cleansing, detoxification and cleansing. You'll want to catch it. She's always got a new twist or two and how she approaches things that just turn out to be different than anything you've ever heard of before. So for that reason, we bring her back to you on the 6th. On the 13th, the girls, Judy and Susan, are going to be here. I'm talking about the girls because they have a company called Three Rivers Thermography. They travel all over the place doing thermograms for our ladies, and men too, but predominantly ladies, especially those women who have now shed the ugly coattails of mammography. They don't do mammograms anymore. They do thermograms, which is okay with me and certainly okay with them. Much better for them in terms of being able to diagnose any suspicious lesions, and of course, much less traumatic, if you know what I mean. Anyway, she's going to be here. They're going to be here on the 13th, talking about some special they're offering in the month, the remaining weeks of April and into May. We'll let the girls tell you about it when they come with us on the 13th. On the 15th, David Brownstein returns, and we're bringing him back to talk about the second of his many books. Of course, he kicked it off here last month, or this month, with his book entitled Iodine, which was his first offering as an author some 8 years ago. But according to what I've been able to read and the number of books I now have from him, the very next work he swung into was, and it made sense, to discuss thyroid disease. So his book on thyroid disease is what we'll be discussing on the 15th. It links very closely with iodine, as those of you all know out there. And so, especially with all this Japanese radioactivity stuff going on, he'll be the appropriate guest. I don't know what will have happened in Japan in the ensuing number of weeks, literally 3 to 4 weeks. But I'm guessing it's not going to get better out there. It is just going to get worse. Now, on the 21st, we mentioned it here on Friday. You were listening to the show. We had Jerry Singleton on our show on Friday. Jerry, of course, represents a company called ProLogic, and they are the sole distributors of the device we've come to refer to as MCG. This, of course, stands for Multifunctional Cardiogram, and this wizardry, electronic wizardry, now allows us to do in a completely non-invasive way exactly what would occur if you had a full-blown cardiac cath, and you know how invasive that is and how troubled it can be with risks and side effects and other things that you absolutely don't ever want to go up against. No one would just walk in to say, how about doing a cath on me? But the information would be really valuable if you could get that information without having the cath, and that's exactly what MCG testing does. We've now had 3 different, I don't know, there's sort of been marathons here where we've invited the listening public to come on in and take us up on our offer. A completely insurance-covered testing, completely non-invasive. You remain fully clothed. The test takes 6 minutes, or actually 5 tests to get done. Each one of the 5 takes 82 seconds, and a little clip just goes around each of the ankles and each of the wrists, and 1 lead is placed on the left side of the thorax. 1 lead makes it a 5-lead test. Anyway, we have set and established his return to do another one of these seminars here. Well, treatment seminars and marathons, however you want to say it. And that's going to be on the 21st of April. So you did respond, folks. I walked out to the book on Friday mid-morning, and here we only had launched the doggone thing at 9 o'clock, but a number of you responded. I thank you for that. You'll really appreciate the fact that you get this thing done. But the list is starting to accumulate and accrue, and we're going to try to get a total of 32 patients in here. We're going to be doing it for 8 hours, starting at 9, going to 5. Every 15 minutes, we've scheduled another patient. We have moved through that schedule fairly well in the past. We're anticipating that we'll do it as well, if not even better, this time. So you won't be here too long. While you're here, I can tell you this much. You'll want to go ahead and take the time to schedule your revisit, because you'll want to go over the results. And we've had a number of revealing items be presented to both myself and whoever the test was done on. Sometimes, really surprisingly, excellent scores. Even a surprise to the person who scored 0. That's what happens. You get a 0 to 20 score. 0 meaning absolutely no disease whatsoever. Can't go up as high as a 20. I haven't seen one. Highest my patients have scored is an 11 up till now. Not to say we can't get it higher, but at least at this point, 11 has been the highest. And everything in between, and to go over the results to allow you to do what I think is really the key component to this test. Find out what your coronary artery status is, and this exam certainly will allow for it. And then once you know, go ahead and change it, improve it, and keep on doing MCG testing into the future to show that you have improved it, because I believe that's what we're going to be finding out as we move down the many, many months of the remaining amount of 2011, and as we even move into 2012. Repeating this test should be a bonus for everybody to then get confirmation that what they're doing, and we have so much to offer here in the way of what to do that just wouldn't be found in the conventional medical community, simply because they're mostly medicine-driven, and medicines are just fine in some settings, but they certainly don't change the course of the cardiovascular disease process, because that just keeps marching on. We want to stop that process. We want to back that process up. You need to know where you are in the process, and then through these non-invasive tests, follow and track out well into the future how you're faring with this disease process, which really ultimately encompasses everybody. You just need to know where you stand now as well as into the future. So give us a call, 724-942-3002. That's 724-942-3002. You can start making those calls right about 9 o'clock as soon as our office manager gets in here. Right now, I don't think anybody would answer, unfortunately. But give us the time to get Kim in here. You want to ask for Kim, and she'll get you scheduled for a time slot sometime throughout that day of the 21st. Okay. Let's do this. Let's take a short break. In the interim, I'm going to come back and talk to you about, I checked the blogosphere. I checked all the media, and wouldn't you know, they're fixing to launch another one. Well, what's happening is the medical profession is getting the saddle shoes and the pom-poms out again. They got another cancer drug, folks. Oh, my God. Here we go again. Let's take a look at it. Be back in a moment. You will be, too.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this rather chilly, bright outside, yes, but chilly outside day. Bundle up extra warm and extra tight today as you venture on outdoors. Here indoors, we're going to let you come on in if you'd like and give us a call, set the agenda around here. The number to do that is 412-825-6262. That's 412-825-6262. Anything on your mind is okay with me. Question or comment, we benefit from it all, folks. And I tell you this, as you have learned, if I don't know the answer to one of your queries, one of my listeners will. And they'll be following up really close behind with a whole bunch of suggestions. And just give it a try, folks, and you'll be amazed. Sometimes I know I am when I hear all those responses. In the interim, I thought I'd, this one always gets my blood boiling because they're fixing, they've already fixed it. They've already decided to do it. They've launched, meaning the pharmaceutical industry, in cahoots with the FDA, have finally launched another drug, another cancer drug, and I thought, and every so often it happens, about 2-3 times a year, sometimes a little more, sometimes a little less. We get these blurbs in our newspaper. They get multi-column spreads out of these launchings. And I'll tell you what, I'm looking for a launching of a cancer drug that varies in some way from every previous launching. But when I looked this time, I found the same doggone thing. Here's what I mean. And you'll see what I mean in just a moment. This is a drug that is being launched to treat malignant melanoma. Now, that's a pretty serious cancer. It is a very deadly cancer, as a matter of fact. And whenever you read the article, and these articles, no matter what time of the year we're seeing them, no matter what drug gets launched, they sort of have a similar byline. A whole bunch of fervor. Everybody's worked up. I rhetorically say that they're out there putting on the saddle shoes, getting the pom-poms out like cheerleaders, because when you read these articles, you think that they have now released the greatest drug known to man to help in malignant melanoma. Well, let's just see. Even their honesty, at least I'll give them that much, but it's paled honesty. It's shrouded in a pretty shabby way. But the first words of this article, and this literally comes out of the Trib Review. This is just Saturday, so it's fresh. It's hot off the press. I found it in the blogosphere also, so it's not as though it was just unique to the Trib Review. First of all, they talked about the drug as a breakthrough. Well, I think that it's pretty commonly the way I've found all of these articles, no matter when they come out, no matter what cancer they're supposed to be for, it's always a breakthrough drug. Well, okay, so what? It's a breakthrough. Now, the next little part of this article is one that starts to raise an eyebrow, because after it says it was a breakthrough with respect to the treatment of malignant melanoma, then it went off to talk about, and here it comes, and when I saw this, I said, now I haven't seen this too much before, but here it is. They go, it's the first drug shown to prolong the lives of melanoma patients. Now, what does that mean? Does that really mean what they intended it for it to mean by using the English language? Actually, the first drug? And so does that mean anybody that had malignant melanoma in the past and was receiving chemotherapy for it in the past, does that mean, what does that mean? Does that mean that what they were using and were treated by the medical profession for the melanoma, was that really not doing a thing at all? And in fact, that's exactly what it means. Because in the same article, these boys had the huevos to say, you know what, we had 2 other drugs that had been used, and the last one that was released to the oncology community is now 13 years old. So there are these 2 drugs, and they didn't work, they don't work, and so we have a breakthrough. Well, I'm interested when there's a breakthrough. And so I read on. By the way, the name of the drug, I don't know whether they're kidding or whether this is really, well, yes, I guess it's really the name of the drug. The name of the drug is Yervoy. I'm not Jewish, but seems to have a little Jewish ring to it, if you know what I mean. Yervoy is the name of this new breakthrough medicine. Here's what they just did about Yervoy in the article. Yervoy only work. Now, here's a bit of honesty. You gotta hand it to them. While they stand there with, with the short skirts on and the saddle shoes shine and the pom poms, here they go. They go. Yervoy only worked in a small segment of patients that were studied. Okay, what's new there? It's the same crapshoot that it always has been, and at least they had to admit it. Only worked on a small percentage of the patients studied, and on average, when it did work, it prolonged life for 4 months. Now, this is the part of all of the articles that I see where a new cancer drug is being launched that I have to put in the category of they just don't get it. They just don't get it. If you can stand there with your little short skirt on and your saddle shoes and the pom-poms, and you can start waving those pom-poms in the air and celebrate the launching of a drug, breakthrough drug. Thank goodness a breakthrough drug to the extent that anybody with previous malignant melanoma really wasn't, what were they getting? The article actually said it didn't do anything at all. Now, what do you think they were telling patients with malignant melanoma last week or the month before? Geez, it's an awful tough one. Anyway, by prolonging life 4 months, they admitted that usually the life expectancy is 6 months, that the life is now being prolonged 4 additional months, 10 months, and with that, they still have the huevos to say, nonetheless, and I'll quote the words, nonetheless, they herald it as an important milestone. It is a milestone, and this is why when it comes to the fact that they don't get it, and they really don't get it, statements like 4 months of additional life. Look, I can appreciate the fact that there's 4 months of additional life, but no one just speaks of the quality of life of those 4 months, on how much of an affliction can be expected from just receiving whatever the medicine is alone. And by the mere fact that it's a chemotherapeutic drug, you better believe there are a whole host of side effects and complications and risks that go along with it. So the 4 months of additional life, what is the quality of life, and how has that been hampered by the use of Yervoy, this breakthrough milestone drug that replaces two other drugs that now, full admission on the part of the conventional medical community, never really did squat when it came to treating malignant melanoma. These are the times, folks, when they get so excited, talking about the conventional medical community, getting so excited about launching a drug that they just forget themselves for a moment, and they don't realize when they speak how they implicate the charade, the scam, the unpleasantries of what has been used up to that point. They just completely discard it and go, oh yeah, that stuff, the stuff we were using last week, oh, that never worked. That stuff never worked. Oh, now we have something that works. It works, and you get 4 months more. It's a great one. It's 4 months. Oh yeah, there's some rough side effects here, but it is 4 months. This is why the oncology profession is a little difficult. I don't know. They shave in the morning. They look in the mirror with stuff like this. Anyway, when it comes to the cancer issue, you've been educated well, at least on this show, folks. I'm going to bring you back to, I say, the three basics that I believe with the knowledge of these three, you are armed against the conventional medical community. At least you'll know how to interact with the medical community with respect to choosing for yourself and for your family as to whether or not you're going to allow the use of these chemotherapeutic agents to be used on your behalf. So let's do this. Yervoy now is that really the name? Yervoy is now launched this milestone drug. The first drug shown with any ability to prolong the life of someone with melanoma. Going to come back. Going to take a short break. When you come back, hey, what do you think about Yervoy? I'm going to talk about those three basic issues that if you keep them straight for both you and your family members, you won't go wrong when it comes to choosing as to whether or not you want to be treated with conventional therapies. I'll be back in a moment and give you those three items. I bet you can remember them already, huh? Be back in a moment with them.
Have you been to the doctor lately? Was fatigue top of your complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Fruit of the Spirit. The blessings of Fruit of the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Fruit of the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, 5 servings of fruits and minerals with no added sugars. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you on this Monday version of the show, kicking it off, launching a week where we're going to open it up to you a lot this week. Anything on your mind is okay with me. I tend to share, and come to you with things that cross my desk, cross my own brain. Whatever crosses your desk or your brain is, it's your own personal information. But you may want to share that with us too, so give us a call, 412-825-6262. That's 412-825-6262. I'll be listening for a knock on the door. Now, back to the issue of cancer treatment. It has been a topic we've covered many times throughout the years, and it keeps on coming back. It's the gift that just keeps on giving, because you can just count on the fact that, the conventional medical community is always out there looking for another one, and whenever they launch their other one, whatever it happens to be new, they end up really trashing the ones that it's replaced, so much so that you go, well, what the heck were you doing whenever you were using that other stuff that now you don't think too much of? And then when we read about how really not too good the new stuff is, it really calls the entire issue into question. Well, I got many times have the opportunity to sit across from patients who are anguishing, going through, whether it's their own personal situation to themselves, or a family member, having to sit through what to do. What do you do? They come to me and they say, how should I deal with this? Now, I mean, the cancer protocols that we get into here are quite lengthy to describe. We won't even attempt to do so here. Let's just say there is absolutely a non-toxic approach to any cancer that I believe is, except in a few cases, far superior than any conventional option. Now, in those few cases that I'm talking about, these are the few cases where there actually is a chemotherapeutic approach to the treatment of a special cancer, and even though there are side effects of the chemotherapeutic drug, the ability in the highest percentage of cases to completely eradicate that cancer is within the realm of possibility, and it needs to really be considered and really given a chance in the mindset of a patient to let them try it, to actually seek oncological help. The few cases here are things like, we often use, because we're in the land of Mario Lemieux here, and we have Hodgkin's lymphoma as one of those that respond in many cases very well to conventional treatment. And even though there is a chemotherapy, and even though that does have side effects, there is a grand potential in a percentage of cases, and I think that's the oncologist's job to describe what the percentage of potential would be in each individual case. Nonetheless, there is some very good potential, at least, for a conventional treatment of something like Hodgkin's lymphoma. I'd say another one of the cancers that has a great potential in order to have a response are some of the leukemias, especially childhood-type leukemias. I'd also say, and this has changed markedly over the last 15 to 20 years, testicular cancer. You can think about Lance Armstrong. I have to say that he is a great turnaround with respect to his diagnosis of testicular cancer. But now he's cancer-free and proud of it, as he should be. But except for those rare cases, just about every other form of cancer that you can mention has literally paltry results with respect to chemotherapy. And in order to keep you all safe, remember these, I'm going to hit them again, these three issues that once you have them in your own lexicon, once they're in your set of notes, once you have these at your ready disposal, then you're ready to confront the oncology community and be able to ask the right questions in order to get answers. Unfortunately, what I think happens so often is the question, it's just the folks are too stunned. They're just too upset. The psychological hit of being the carrier of a cancer and the potential outcomes that is pointing to doesn't allow for the patient to really be emotionally stable enough to want to probe. That's why I always recommend that each patient who goes to visit their oncologist, each patient, by the way, who comes to visit me, should really have a patient advocate with them. They should have a person, a lot of times a person outside of the family and detached emotionally, but of course many times found to be within the family, nonetheless someone that can take these facts and do something with them. Well, here's a few facts that I think we have to allow you to have at your immediate disposal in order to allow you to be able to intelligently have a discussion with your oncologist. Point number one. Point number one is this famous Courtney 1 millimeter rule, which you'll find written nowhere. I've never seen it written down in black and white. It just doesn't exist in print. Yet every time I'm with my conventional colleagues, surgeons and non-surgeons alike, anyway, medical doctors nonetheless, I say, you know what, let me throw this out to you, and what do you think? And let me know whether you think what I'm telling patients is right or is it incorrect. Should I be maybe watching how I phrase this? And they go, okay, tell me what's on your mind. So I go, okay, here's the 1 millimeter rule as I see it. Anytime a malignancy has attained the size of 1 millimeter, it's already off to the metastatic races, meaning it's already moved outside the confines of where it started growing, and it's moved elsewhere. And we're not going to know for quite some time where the elsewheres are. Nonetheless, 1 millimeter is pretty small. It's about the size of the head of a pen, not a pin, but a pen that you write with. Right, that's pretty small. Anyway, 1 millimeter rule, after I'd mentioned it to them, and they have never seen it in writing anyplace else either, but to the person, just with very few exceptions, they go, you know what, I think that's right. I think that, yeah, that pretty much says it all. And so I've not come across many occasions when my colleague was willing to take me on. They may have hemmed and hawed. They may even said, well, in some cancers, maybe have to be a little larger. But you know what? They weren't quibbling with it. And this is a vital tool that every listener to this show and any person who is in the throes of a cancer having to make a decision needs to know. Because with the knowledge of the 1 millimeter rule, I oftentimes really become critical of the kabuki dance that envelops and begins to take shape, especially with things like breast cancers, because the immediate next step once the detection of breast cancer occurs, and by the way, let's just say, without getting into mammograms right now, because that's really not the intention of the discussion, but let's just say that there's never been a malignancy, a breast malignancy determined the size of 1 millimeter. It's got to be at least a centimeter, which is 10 times larger, and more than likely it's 2 centimeters, which is 20 times larger, and more than likely it wasn't even a mammogram that detected it anyway. It was a breast self-examination where the woman discovered a lump, then went to her gynecologist, and the gynecologist said, oh, let's get a mammogram. Now you want to get a mammogram. What happened to the one last year? Why didn't that pick this up? And we'll just let that go. Anyway, these lesions are never found at 1 millimeter of size, yet the kabuki dance begins. The confirmation of a breast biopsy, followed at the same time, usually with a lumpectomy at a minimum, and sometimes mastectomy is where it goes next, to have the surgeon then tell both the patient and the family that they got it all is usually what follows the discussion right after the operation. And the family feels very good about hearing that he got it all, and that really means he got all the borders. He went in there and was able to carve out this lesion and making certain that none of the borders were disturbed, so that when the pathologist looks at the slide under a microscope, he can see that nothing penetrated the capsule of that tumor, and in so doing, it's all contained within the block that was sent off to be dipped in the formaldehyde and then prepared in the paraffin in order to make the slides. But the point is this: the 1 millimeter rule still holds up. And you know, after you hear the very next thing out of the surgeon's mouth, which is after he said that he got it all, his next thing is to say, okay, we got it all. Now, chemotherapy does begin on Monday morning, and the family's bewildered. The patient's bewildered. What do we need chemotherapy for if you got it all? The truth of the matter is, they didn't get it all. And the truth of the matter is, there's a 1 millimeter rule. And the 1 millimeter rule says it is already off to the races a long time ago. Where it is, we do not know. All we do know that in time, it's going to rear its ugly head once again and be able to cause some real havoc when that finally happens. The areas most critically afflicted whenever the ugly head gets raised, I'd say there are three: brain, lung, and liver. These are the three. And most assuredly, brain has no forgiveness whatsoever at all, any size at all, creates major havoc. Lung, because of its ability to erode into the breathing apparatus itself and to provoke the formation of large amounts of mucus, also is a difficult hurdle. And then liver, too, but the liver doesn't have immediate consequences. It's going to have much more delayed. Nonetheless, that's the 1 millimeter rule, and you just need to know it in order to be able to have an intelligent conversation with whomever. If it's the oncologist, if it's the surgeon, if it's the gynecologist, once the 1 millimeter rule sort of gets exposed, then the pretext of the intention here sort of has to fall too. You got it all? Well, no, you didn't. Point number 2. I try to have my patients and their advocate, whether that's family member or not, also be armed with 2 basic questions. You've heard me mention this before. I now mention it again because, well, they launched another drug again. And the next time they launch another drug, I'll probably launch into this discussion one more time. The point number 2 is the 2 basic oncology questions. Here's question number 1. Write it down. Question number 1. Dear Dr. Oncologist, with my form of cancer, whatever that may be, and the stage of cancer, which literally means how much, if any, of the metastasis has occurred, because there's stages 1 through 4. Stage 1 usually means all contained. Stage 4 usually means everywhere. So based on my cancer and my stage of disease, what are the 1, 3, and 5-year survival rates if I elect to do the treatment that you recommend? So that chemo stuff you have there, that radio stuff that you're mixing up back there, if I do exactly what you tell me to do, what are the 1, 3, and 5-year survival rates? So that I can know what the upside is, okay, versus the downside. And at that point, you're going to know about the honesty of your oncologist, because I will say this much: the oncologist has the answer to that question at his beck and call. It is on the tip of his lips. It is with a snap of a finger. that his literature has already let him know what the 1, 3, and 5-year survival rates are. So any hesitation on the part of the oncologist at that point means you probably need to start backpedaling for the door, because honesty is not happening there. I have had both sides of this coin reveal itself. Oncologists who were absolutely honest enough to reveal the 1, 3, and 5-year survival rates literally in a nanosecond, and then those that started to tap dance around the room as if it was a reenactment of Fred and Ginger, if you know what I mean. So that's question number 1. By the way, there are no 7, 9, and 12-year survival rates. Funny how that is, huh? No. In medical language, if you survive for 5 years in 1 day, and you're still breathing, and it doesn't matter what your status is. You may be on a ventilator, being assisted with your breathing. But if you survive 5 years in 1 day, that is a home run. It is a medical home run. And no other statistics are going to be kept. And that really is another tragic exposure of pulling the curtain away from the wizard and exposing the emperor with no clothes. Now, the second question. Question number 2. Do you get or you don't get? Either you get the answer to that question or you don't get the answer. And I say if you don't get the answer, you need to be backpedaling toward the door because you're not dealing with an honest broker. Next question. Okay, doctor, thank you very much for giving me the statistics on the 1, 3, and 5-year survival rates with the treatment that you recommend. Now I got another question. Here it is. With my form of cancer and my stage of the cancer that you used a moment ago to tell me about the 1, 3, and 5s with the treatment, what are the 1, 3, and 5-year survival rates if I elect to do, here it comes, nothing at all? I mean, if I just did nothing, I just went home and went about my business, what's the 1, 3, and 5-year survival rates for that? Now, at this point, you're really going to have a jumpy oncologist on your hands. He will really still break out in quite a tap dance at that point. And for that reason, I'm going to give you the answer to the question. And the answer to the question is, there's no difference. That the survival rates for 1, 3, and 5-year survivability with or without that treatment are the same. Now, I don't want to hear about weeks, or I don't want to hear about a month or 2, because that just would prove to me you don't get it either. And I say the medical profession doesn't get it when they got the pom-pom shoes on, and they can say, we got the first drug, and you now live 4 months longer, and I say they don't get it. I don't want to be hearing about weeks or months either. Essentially, there is no difference. And what about quality of life? See, I contend that if you did nothing, and I'm certainly not proposing that you do nothing, I'm proposing that you do a whole bunch, and I'm proposing that you proceed with a complete non-toxic approach to eradicating that cancer. Nonetheless, if you did nothing, though, to find out that there really is no change in the 1, 3, and 5-year survival rates, has to be illustrative of a point. These chemo drugs are bad. They don't do what everybody is wishing for them to be able to do, and I'll be the first to let you know when they're able to do it. And in the few cancers where they can do it, I'll just let you know what they are. Nonetheless, those are the 2 questions you need to be armed with. And when you're armed with those questions, now you can have a fair talk and a fair discussion with your oncologist, who you hope want to be honest enough with you to give you those answers, to allow you to make a decision as to whether or not you truly want to pursue the chemotherapy regime or whether you don't. Now, point number 3. Point number 3 is a very unique one. I never found it written anywhere either, at least in the way I'm going to put it to you. But every time I reveal it to patients that happen to be sitting in front of me, their mouth drops. And so, let's see how you do with it. Whenever a pharmaceutical company applies to the FDA to get approval for a drug, the FDA has many hoops that that pharmaceutical company has to jump through. And usually it's based on a concept of tumor shrinkage, if you know what I mean. And so, unfortunately or fortunately, however you want to view it, in the conventional medical world, it seems like the patients are living from one CAT scan to the next, hoping that they can be put into, and here's the word, remission. Put into remission. Now, what the heck is remission? What does remission mean? Well, best I can tell, as a medical doctor myself, this is whenever the tumor actually responds to the chemotherapeutic agent by shrinking, by diminishing it in size. Now, nowhere in the goal and objective of the therapeutic agent, the oncological drug, is it ever in the cards to eradicate the tumor. That's never in the cards. It's only at best to shrink the tumor. It is never to eradicate the tumor. And with that in mind, we really need to talk about this third point. And the third point is this. There are rules the FDA sets up in order to be able to grant a approval to release a cancer drug. And although there's a whole bunch of rigmarole and mumbo jumbo that we could talk about, let's just cut through it and let's get to the two pieces of those rules which appear to have the most wallop behind them. Point number 1, the FDA says that in every cancer and a drug that's going to be used for that cancer, that drug has to demonstrate the ability to shrink tumor size by at least 50% in a certain percentage of cases. Now that would vary with cancer to cancer. That means that the most precarious cancers, let's take pancreatic cancer, when there's so very little ability of any chemotherapeutic drug to do anything. So in pancreatic cancer, that would be a small number. In other forms of cancer, that could be quite a large number. But this drug that's supposedly asking to be approved by this pharmaceutical company from the FDA has to demonstrate the ability to shrink at least 50% in a certain percentage of cases in order to be able to be licensed and have the ability to hit the marketplace. Now, it doesn't say how long. Yes, it does, matter of fact. I think in the next sentence, here's the point I want to make. The part of the paragraph that gets let out is the next sentence. And that is that, okay, it's got to demonstrate the ability to shrink tumor size by 50% in X percentage of cases. That varies according to the cancer. But the next sentence in the paragraph says, and maintain that shrinkage for 72 hours. 72 hours. 72 hours. And at that point, the patient's mouth drops open, the advocate's mouth drops open, because that's the only standard that these drugs are being held to. And you would all admit, 72 hours doesn't appear to be certainly that much to me, let alone if you had the cancer itself. Now, those are the 3 points that I love to every so often bring back, and usually whenever they launch another one, I go, there they go again. They got the saddle shoes on. They're shaking the pom-poms. We're going to have to peel back all that hoopla and fa-la-la and get down to the nitty-gritty. And so we did it once again. There'll be some time passed, ladies and gentlemen, until it's necessary to do it again. But I think within the context of as much as cancer is it's the number 2 cause of death, and it's quickly approaching and soon to surpass the number 1 cause of death, was this cardiovascular event. And between the two of them, well, that's greater than 90% of the death each and every year from 2 things, and 2 things only. Now, I was interested to see, while I was, it's such dismal discussion, I know, but it's very revealing, and it's quite honest. I was going through the blogosphere, and I came across an interesting little ditty here, because it's from Dr. Nalini Chilkoff. Dr. Nalini Chilkoff. And she's a health and wellness expert, and she came up with a statistic I'd never heard of before. And the statistic is that approximately 83% of people with cancer use at least one complementary and alternative medicine modality. That made me smile. I hope you are too. Hope you enjoyed our show today. Sorry about the ranting and raving. Hey, you could have called in. You could have taken over, you know. Anyway, enough said on this issue. I'll be back with you on Wednesday. Till then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, MD, Director of the Courtney Medical Group, located